It's recording. And I'll move the microphone over here, and
Okay, I'm Hank Hughes, and I'm the Executive Director of the New Mexico Coalition to End Homelessness.
So, how do you think a person's health affects their affordable housing situation?
Well, my experiences with homeless people, and homelessness definitely affects people's health in a negative way, and also people, when they become disabled to the point that they can't work because of health, often become homeless.
Okay, so how do you think a disadvantaged family that maybe doesn't have a good housing situation, how would that affect how their children grow up?
It affects the children in a number of negative ways. One is that children who are homeless usually don't attend the same school for the whole year, and that really interferes with their education. And it also means that even minor health problems can become major. I remember one homeless family that I knew where there were two boys in the family, little boys, and they got athlete's foot so bad that it took a number of trips to the doctor to get it taken care of once they were staying at the shelter where I worked, because it just hadn't been attended to. And normally athlete's foot, of course, is something that people deal with easily, but when you're homeless, even that's really hard to deal with.
So how do you think the current health care bill positively or negatively is going to help people who are homeless or not living in the best situation?
Well, it'll definitely help because more people will have health insurance, and Medicaid will be expanded, which is the health care insurance for people who don't have very much money. So people will be more likely to go to the doctor if they have health insurance and get things checked out early, which is how they get treated faster. One of the problems that homeless people have is that if they don't have health insurance and a place to live and a regular doctor, then they don't often go to the doctor for even minor health problems or for checkups. So, for example, they might not know they have cancer, or they won't know they have heart disease, and so homeless people die of those diseases at a much younger age than people who are housed and have good health care.
Can you think of an example where somebody you knew was in a bad health situation, but if they'd had a more stable housing situation, it wouldn't have been so bad?
Yeah, there was one man who was homeless a long time in Santa Fe, and he had been actually a star football player when he was younger, but due to a couple of problems, he was homeless. And unfortunately, one winter, he was sleeping outside and he got frostbite so bad that his foot had to be cut off, which was really a shame because he wasn't very old. And so that's an obvious reason why not being housed is bad for your health.
Okay. And how do you think Habitat for Humanity and other organizations like that help with people's health?
Well, having safe, clean, affordable housing is obviously very important for a lot of reasons. So, I mean, there's the obvious reason that you're protected from the elements, so you won't get frostbite and lose your toes or your feet. But also, Habitat and other groups usually make housing that's, up to modern standards, which means it's not going to have a bunch of mold in it that will make people sick, or other things. So, having healthy housing is important also. And then since people who live in Habitat houses or other subsidized housing get to stay there for a long time, then that means they can take advantage of the health care options that are available in their community. They can have a regular doctor and go for checkups and those sort of things.
Okay, cool. Thanks, Dad.